My project proposal is improving patient education for outpatient surgery patients. This is the graphic I designed to implement the ideal discharge planning framework that was designed by the Agency for Healthcare Research and Quality. The goal of implementing this program would provide a safe transition from hospital to home for patients by preparing both patients and families for a safe and speedy recovery from surgery. The word ideal is a mnemonic for the components of the framework. These are I, include, D, discuss, E, educate, A, assess, and L, listen. The detailed components of the ideal discharge planning framework address common discharge planning problems, such as changes in medications, inadequate preparation for the patient and family, disconnect between the patient, family, and the educator, and the discontinuity among multiple providers giving care to the same patient. First, we want to include the patient and the family as full partners in the discharge planning process. This means we should always include the patient and family in team meetings about discharge. We need to identify which family or friends will provide care at home and include them in conversations. Next, we will discuss with the patient and the family 5 key areas to prevent problems at home. We'll describe what life at home will be like, including the home environment, support needed, what the patient can or cannot eat, and activities to do or avoid. We'll review medications using a reconciled medication list to discuss the purpose of each medication, how much to take, when to take it, and its potential side effects. We'll highlight warning signs and problems. We'll identify those warning signs or potential problems, and we'll write the name and contact information of someone to call if there is a problem. We'll also explain any kind of test results. Explain test results both to the patient and the family. If test results are not available at time of discharge, we'll let the patient and family know who they should get the results from and when, and we'll identify who to call if they haven't gotten the results by the date listed. Lastly, we'll make follow-up phone calls or follow-up appointments, We'll offer to make follow-up appointments for the patient so that they know exactly when they will come back to see the doctor for the first time. Next, under the E, we'll educate the patient and family in clear, straightforward language about the patient's condition, the discharge process, and the next steps through the hospital stay. We'll do this by creating non-generalized patient-specific education materials. We'll begin education as soon as possible prior to surgery. Patients will receive a pre-op education booklet at home prior to surgery. We'll elicit patient and family goals on arrival to the hospital. We'll encourage patient and family to take part in the care practices to support their competence and confidence in caregiving at home. And lastly, we'll provide the provider will involve the patient and family in any kind of surgical plan. Next, we will assess under the A mnemonic. We'll assess how well doctors and nurses explain the diagnosis, condition, and next steps in the patient's care to both the patient and the family, and we'll do this by using the teach-back method. We'll provide information to the patient and family in small chunks, and we'll repeat key pieces of information. We'll ask the patient and family to repeat what you've said back to you in their own words so you can be sure that the information was explained well. Patients and families will also complete their Be Prepared to Go Home checklist, and a post-operative telephone follow-up will be completed by the DOSA nurse using a script on post-op day 1. Lastly, we need to listen to and honor the patient's and family's goals, preferences, observations, and concerns. We'll invite patients and families to use the whiteboard in their room to write questions or concerns. We'll ask open-ended questions to elicit questions and concerns. By using the Be Prepared to Go Home checklist, we'll help solidify to the family that they feel prepared to go home. What I really enjoyed about this program is that the AHRQ wants to assist with a seamless implementation of the IDEAL framework. They have multiple resources, including PowerPoint presentation materials available at no cost on their website. Hospitals can easily adapt the pre-made PowerPoints to their facility and their training program needs. Electronic versions of the Be Prepared to Go Home booklets, lists, and check sheets are also available online. Thank you for listening. I hope you've enjoyed learning a bit about implementing the IDEAL discharge planning framework that will support a successful recovery for outpatient surgery patients.